Good afternoon. Welcome to Nashville General Hospital's Wellness Wednesday Facebook Live program. We appreciate you joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. January is Cervical Cancer Awareness Month. So joining us this afternoon is Dr. Nathaniel Klein, a highly specialized GYN who provides patient care at both our Nashville Healthcare Center Midtown location off of Charlotte Avenue and the main location here at Nashville General Hospital.
Dr. Klein is a graduate of Chicago Medical School at Rosalind Franklin University and completed his residency at St. Joseph Hospital in Chicago. He went on to complete his fellowship in minimally invasive gynecologic surgery at University of Nevada, Las Vegas. With both an MD and an MBA, Dr. Klein mixes his medical, business, and research background in augmented and virtual reality to pursue innovation in patient care and drive the future of medicine and surgery. Welcome, Dr. Klein.
Hi, thanks for having me. Can you hear me?
Yes, we can hear you, and you can begin your presentation whenever you're ready.
Well, thanks for having me. Okay, so talking about cervical cancer screening and having a great opportunity for an awareness month, that's amazing. Because cervical cancer screening, there's been great strides in from where it started to how things have progressed over time. And but with that being said, things have recently changed. There's some great research that has come out that it's changed some of the screening guidelines, and to be most up to date is really the best way to do your cervical cancer screening. Now, with that being said, some of the guidelines have changed to the point where typically women are used to going every single year for their annual and getting a pap smear and being on that schedule, which is very easy to remember. And these screening guidelines have extended the time frame for how often you need to do your pap smear screening. Now, part of that is really good because we have better risk estimates for what these results show us. But there's a downside too, if it's not on your mind that this is something that you do every year as more of a default rather than kind of, was it 3 years or 5 years or what do I need to do, and based on your age. And so there's some problems that I see that could happen from this, but overall it's been a really, really good thing that's been happening. Now, with COVID and having issues coming into the office and all of that has changed some, it just has caused problems everywhere. And same thing with cervical cancer screening, because it's easy to put that off because you are worried about your health and not wanting to be exposed and things like that. And that's what you should do. However, you don't want to miss something that you could definitely prevent. So talking about cervical cancer, I have a couple slides to go through and then we'll take some questions. Okay, can you see my screen? Can you see my screen here?
Yes, we can.
Okay, great. So why is cervical screening important? And it's important because you're preventing cancer. That's what you want to do, is a really great tool to catch things early and stop them from progressing. Now, with that being said, cervical cancer is still the fourth most common cancer in women, and that's a really high number when you're talking about cancers. And with pap smears doing such a great job at catching things early and still having a really high incidence of cervical cancer, there's some disconnect there. And there's a real reason for why that disconnect is there, and something that we can absolutely change. And so really getting the word out there for how to do cervical cancer screening for women is one of the most important things to do, because we can prevent this, and that's what we want to do. And there's some things that are outside of our control and that we can't change, but for cervical cancer, this is something that we have some really good tools. So now, with over 13,000 women in the US developing cervical cancer it's mainly because they skipped their primary screening, or that they did some primary screening and there's some abnormality and additional recommendations were given to follow up to do the next steps in evaluation, and that was skipped. And that's where these gaps in care happen, and that's what we don't want to do. And a lot of that has to do with understanding the reason why you're doing the screening, what the results mean, and really talking about it, because it is definitely complicated. So the first thing to talk about is really, when should we test? And the screening guidelines have changed, and before we were doing it every single year. And there's two types of tests that you do. There's a cytology, which is the cells of the cervix. So you're looking at the cervix and getting a sample of the cells of the cervix, and that's called cytology. There's also testing for an HPV virus. Now, there's a lot of talk about HPV virus, or a lot of talk about virus with COVID, but HPV virus is a virus that can cause some cervical cancer, or some cancer, precancer cells of the cervix, to become more aggressively abnormal if it's there. There's several different types of HPV, and these subtypes have numbers. They're 16 and 18, and there's several of them that we worry about. And depending on the subtype that it can be identified, it tells us the risk of progression to a worsening state. And that helps us understand what we should do next and how much to worry about it, or that there's a really low risk and we can continue routine monitoring. Now, with that test, when you do a cytology and the HPV testing, that's called a co-test. Now, when to do this is what has been changing. So currently, there's some recommendations that starting at age 21 is when you start cervical cancer screening. And doing cytology alone every 3 years from age 21 to age 29, and then for women after the age of 30 to do the co-testing, which is the cytology and the HPV testing, every 5 years. That's amazing. And it is some really good evidence that shows the risk profile that allows us to do that. And however, there's still changing that's happening in the research, and there's some societies that recommend you could do the HPV primary testing to start at age 25 and do that every 5 years. And so with conflicting guidelines from one society to the next, really, what should you do and what should you follow? And that's changing, but really that's all of medicine. And what we want to do is be the most up to date with what the best research shows us. And right now, you could do either and be fine, but it just matters on what your results show, and that you're following, if there's risk identified, the level of risk and what you should do next. And your doctor will help you set through that. After the age of 65, that's when we stop pap smear screening, but that's stopping if you've had 3 normal results prior to that. So we can say that there's a really low likelihood of this progressing into cervical cancer, even if we don't screen anymore, because cervical cancer is a slow growing situation. So there's a lot of questions that come up that I hear from patients for pap smear screening, and sometimes patients will get a pelvic exam and no pap smear has been completed, but patients still think that they had a pap smear. And when we're trying to find out what's happened in the patient's history, I'm asking questions about when was the last pap smear, and sometimes patients will say, I had a pelvic exam, but they're referring to it as a pap smear, even though they just had a speculum exam. So a speculum is a tool that you use to see the cervix and visualize inside the vagina. A pap smear is the actual testing of the cervix. So the pap smear screening guidelines that have extended the interval for follow-up from 3 years to 5 years, depending on your age, that doesn't mean you still shouldn't see your OBGYN every year, because you're still doing pelvic exams and you're evaluating different things. And so you should still follow up every single year with your OBGYN, but that doesn't necessarily mean that you need a pap smear every year. Now, if you had a hysterectomy, is something that I get a lot because I do surgery for women primarily. Do you need to continue to do pap smear screening? And it really depends. Depends if you had a hysterectomy and the cervix was left behind, or that was removed as well. And it also depends on what your past history was. If you've had an abnormal pap smear in the past, what the abnormality was, and how long ago, and what the testing was done after that. But for the most part, if you had a hysterectomy and your cervix was removed, and you had normal pap smear screening history, you don't need to do any more screening for cervical cancer because you don't have a cervix. So talking about the COVID situation and following up and the incidence of cervical cancer, what's amazing is that cervical cancer can be prevented. And that's because there's a lot that we can do. We can catch things early as long as we're staying on top of the screening and we do the best next steps from what our results show us. But there's also another tool that is that we get to use, and there's an HPV vaccine that can really help prevent cervical cancer for the aggressive or the high-risk subtypes of HPV. Now, this HPV is a very common virus that people can get throughout their life. And actually, most people will get HPV at some point in their life and not even know that they had it. Around 4 out of every 5 people, or 80% of us, will get HPV. And most of the time, your immune system will take care of this and treat it by itself around 90% of the time for these HPV infections, and will clear within 2 years. However, sometimes with these high-risk types, they can become aggressive and cause the changes of the cells of the cervix to become abnormal, which is what we worry about for cervical cancer screening. And the reason why we're talking about this is high-risk HPV is found in over 99% of all squamous cell carcinomas of the cervix, and HPV type 16 and 18 account for 70%. So like I said, there's several different subtypes, but 16 and 18, that subtype of HPV, just like COVID-19, we have HPV 16 and HPV 18. Those are the two that are the highest risk for what we're evaluating. And based on what those results show, if you do the HPV testing, that helps us understand what we should do next and how aggressively we should evaluate the best next steps so that we can prevent cervical cancer from happening. So the HPV vaccine is something that is very, very effective and is very safe, and is actually important for public health, because if we can prevent the spread of HPV and prevent cervical cancer, then we're treating our healthcare population in a really big way. And we can do the HPV vaccine early on, and it's best with children during their as they're all getting their other vaccines throughout their life, but it's also before they're becoming sexually active, that we're getting the HPV vaccine before patients have had the chance to get infected with HPV and having it cause other problems. Now, this doesn't mean that if you've already are past being a kid and you've had sexual intercourse already, doesn't mean you can't get HPV, because it's actually approved up to the age of 45, but it just depends on what your history looks like. And even if you did have a diagnosis of HPV, there's several different subtypes that this HPV can treat against, and we want to try to do the best protection as possible. So the vaccine, there's some great studies out there, and it's safe. There's no significant risks or side effects, and it is a bigger issue with trying to get it done and people knowing about it, because most OBGYNs will talk to you about this, but really the best time is for children. And so making sure that we're talking about it and we're asking for it if our doctors aren't talking about it, and trying to get ahead of this, that's the best thing that we can do for our kids and the public in general. So facts about cervical cancer, there's a lot of things that we can really talk about. Like I said, it can take a long time for cervical cancer to develop. It can take 10 to 15 years, but it also can be very aggressive. It really depends on what the results show us. There's some good evidence that shows that Black women are dying of cervical cancer at a rate nearly 2 times the rate of white women. And women that are at high risk for developing cervical cancer are those with poor access to healthcare, and women without insurance, and who have immigrated to the US in the past 10 years. Now, this is because it is the awareness and to get the appropriate testing at the right time and have the follow-up as we need to get ahead of this. And the access to care, and this is highlighted with COVID right now, is something that we can all work on, and something that shouldn't be there anymore, but it is. And so the more we can talk about it and the more we can get ahead of this and ask the questions that we should be asking, because it is an uncomfortable exam, going to the office and getting a pap smear. I don't know anybody who likes getting a pap smear. And so it can be uncomfortable, and to be uncomfortable to ask questions that you might have to understand why we're doing what we're doing and what it means. Because sometimes I'll be talking about colposcopy or other medical jargon that I don't realize I'm saying, because this is what I talk about all the time. And every patient has a different level of knowledge, but I want to make sure you know what's going on, because I care about your health and what it means to you. And I'm here to be an advocate for you. And we're teammates, but I need to know what you know and what questions you have. And so I can figure out how we can figure out to do what's best for you. So how to avoid getting cervical cancer? The best thing that you can do is, let's start with the HPV vaccine and get that and ahead of time and try to prevent things as much as possible. And then after that, really what you want to do is you want to schedule a well woman exam with your doctor. You want to go to your appointment and ask if you need a pap smear or an HPV test, and ask the questions that you have, and so that you understand this. And then if you do need one, or if you don't have your prior results, we can figure out how to best test for whether you need just the cytology or the cytology and the HPV testing. And then if any abnormal results show up, it really depends at that point what we should do next, because we want to catch things early. And if there is an abnormality, there's more testing that can be done, such as a colposcopy, which is a visual inspection of the cervix with a microscope to see that under high power field, to look for more abnormalities, because we want to see what is there and we want to catch things early. And these next steps, even though it might be a little of a headache to follow back up and to catch these things, it helps us avoid a bigger problem in the future. And if there are any issues that are identified, to treat those issues and stop those from happening. And like I said in the very beginning of this presentation, is a lot of times we see cervical cancers because the secondary screening, this follow-up, is skipped and patients don't want to do it or don't understand what it actually means for these results and what it could potentially mean. And then they avoid going to that visit, and it's been years. And then we finally see him in the office, and we're now in a much worse situation that we could have prevented. And that's what we want to do. And so I just gave a quick overview of kind of the general things that I see and some questions, and the take home points that matter the most is just ask your questions, understand what's going on, and follow up with your doctors, and know that even though you were told before that you're getting a pap smear every year, and it may seem different that it's now every 3 years or every 5 years, and what does this all mean? And that medicine is changing, it's going to continue to change. But the best thing that we can do is to stay as up to date as possible and to catch things early. And if we can prevent them with the HPV vaccine, then that's great. And with COVID and not being able to see your doctor, sometimes it matters that you should still go in and get these testings done. But sometimes maybe you are a really low risk situation that you had a pap smear a year ago, and I can collect those records from your prior doctor and say, yeah, this was normal. You don't actually need a pap smear in a year, and we can wait a little bit to let this COVID situation improve and not have you be exposed or anything like that you're uncomfortable with. But it just depends. And so just call, because all I want to do is be here for you. And any questions that you have, that's why I'm here.
Perfect. Thank you very much, Dr. Klein, for all the information that you shared in regards to cervical cancer awareness, but even how you dove into like HPV and some just awareness in general. Because to your point, I think a lot of times when we get that call from the doctor, you go to a doctor's visit, you already have to work up the nerve to go and get checked out for any one of these things. And when you get the call and you're dreading it, what's going to happen, you really don't know what your next steps can be. And Googling and researching on the internet never is a healthy thing.
It's scary. I promise you, every time I talk to a patient, I say pre-cancer cells, they don't hear that pre word, they just hear cancer, and everything changes. And then all the other part of the conversation isn't registered or something. And I totally get that. And so really the best thing we can do, just ask questions. Let's figure it out.
And I do want to let all of our viewers know I am currently monitoring any questions that you have for Dr. Klein in the chat. So please make sure that you ask any questions that are on your heart. But until we get a few questions. I don't know if you can
hear me. I think I'm frozen.
Oh, but yes, we can still hear you. You are frozen, but we can hear you. Hopefully it unfreezes soon. The world of technology. Oh, there you go. You're back.
Sorry about that.
But so I do have a question about HPV or, HPV testing. So I'm you spoke about women are able to be tested because it's a part of, regular pap smear and everything of that nature. But can men be tested as well?
Yeah, you can, because HPV causes other issues, and men can get a vaccination for HPV, and it's a great thing to do. Now, for cervical cancer screening, the HPV testing and evaluation is a different setup for where the research is at. But to answer your question, simply is yes, and that's a great thing to do. To get that HPV vaccine for both your boys and your daughters, whether you have a cervix or not, that can help prevent the spread of HPV, which helps prevent cervical cancer. Now, for however you identify, is if you have a cervix, then that's what we're evaluating, is how to evaluate the cervix and the chance of these cells from progressing. So whatever your partner may be or your sexual orientation, even if you don't have sex with men or anything like that, it still doesn't mean that you don't need pap smear screening, because there's still that risk, and definitely something to talk about.
Great answer. And okay, and then you spoke about abnormal pap smear. So I want to touch on that. So we referenced having an abnormal pap smear and the testing that follows, but then also, like you said, when you call someone or you speak to a patient and they hear the pre word, they don't hear pre, but they just hear cancer. So I guess, in your years of being a doctor, what would you say to someone who gets that call or who goes into the office and hears something is wrong? What would you say? What would be some next steps of, I guess, mentally preparing themselves, or how should they move forward?
I do my best to try to avoid those conversations, and but I'll say something wrong or talking about medicine in the way that I read it and digest it, and sometimes I'll not realize that what I'm talking about, and that patients aren't hearing what I'm saying, or I'm not saying it as clear as possible. Now, what I like to say is, I like to talk about if there's an abnormal result, that there's a range from totally normal to cancer, and there's many different steps that become abnormal. And I like to say, this is where you're at on this range, and it's abnormal, and we wanted to prevent from getting here to really bad or cancer, and how do we prevent that from happening? And so then I start talking about really what the results are, because there's several different types and there's different risks. And so I really like to focus on the risk of how much we need to worry, because I want to make sure that it's important, but I don't want to scare the patient. And I want to make sure that it is understand what we're doing and why, because we want to prevent it from a really bad situation.
Perfect. And we actually do have a question in the chat. So this viewer said, great information. Can a person give birth after a cervical cancer diagnosis?
Yes. So that cervical cancer is, if you had a cervical cancer diagnosis, now that's a complicated situation for how you treat cervical cancer. If it's precancer cells, abnormal cells of the cervix that are not yet cancer, but have a high risk of progressing to cervical cancer, if we're talking about the treatment of that, that can still have implications for pregnancy and how to evaluate things around pregnancy. But if it was cervical cancer, it depends on where you're at and what things look like for your family planning. And it is so to answer your question is, yes, it can be complicated, but it's something that's my job to sort through.
Thank you.
I have a couple of questions. So you had mentioned in your presentation that sometimes cervical cancer takes a long time, 10 to 15 years to be seen. What are some symptoms women need to be looking for if they're not doing a pap smear every year? If you're on the 3-year plan or the 5-year plan, what are some things that might happen to a female that goes, oh, wait, I need to call the doctor. I need to go see Dr. Klein right away?
That's a great question. And it can be a complicated thing to really talk about in a way that the best thing that you can do for cervical cancer is to be worrying about your screening interval and to follow up as planned and why. So if your doctor is talking about these were your results, and I want to see you back here in 3 years, that you come during that time. And that's the best way to worry about preventing cervical cancer, because there's a lot that can happen in the reproductive health area that kind of overlap. And the best thing that you can do for yourself is to follow up when you need to follow up. And if there is an abnormality and you need additional screening, that you go to those visits so that you can prevent it from happening. And that's really the best way and the best thing that you can do for yourself. Worrying about symptoms and thinking, maybe I don't need to do this testing because I read that maybe you have some vaginal bleeding with intercourse, and there's a lot of signs that could be there, but those could also be there for other reasons. And maybe that's at a later stage, and you don't want to rely on that when we have a much better way to worry and to prevent cervical cancer from happening.
And then just kind of circling back to the HPV conversation, I'm a mother of 2 boys, and it was very interesting. The first time I heard HPV was through their pediatrician.
That's great.
And it was at least 5 years ago. And it's hard as a mother to go, wait, my son needs a vaccination for later in life, so a potential wife or partner does not get cervical cancer. And I've really had to come back and talk to some of our other providers over here in our cancer program just to be able to go back to the pediatrician and say, okay, I'm all in. And I think that's important for anybody out there listening. If you do have boys and even daughters, but sometimes it's kind of hard as the mother of boys to think, oh, do they really need this? And it wasn't just a 1 dose process. I mean, they spread it out over, I think there were 2 or 3 shots that they had to take for the HPV vaccine.
And it's not just for cervical cancer. There's other types of cancer that HPV can extend to, and for males. But it's also can help prevent for genital warts that HPV can cause. And so there's other benefits to that as well. Now, in the realm of Cervical Cancer Awareness Month and all of that, like talking about the HPV vaccine for why it prevents that, if we're giving that to everybody and we're stopping the transmission, then just that helps. That's why it's that public health idea that if we can, the more people that we can treat with that, the less HPV that's out there that can be causing these issues. And so every way that we can prevent it, that's a great thing to do. And so but outside of cervical cancer, if we were talking about something else, then there's still benefits for your boys to get that as well.
I think we just have a few more minutes. So the last question that I just had, so at what point would a patient be recommended to you? So, or would they directly come over to you? Like, would you see someone as their PCP, or would someone have to go to a PCP and then be recommended to come and see you at the Nashville Healthcare Center? Like, how does that, or, what step does Dr. Klein get involved in someone's treatment process?
I'm here for whenever and however you need me, then that's what I would say. But for wherever you can get your cervical cancer screening, that's the best thing. So access to care, and that's anyone who can do this, and that's what should be done. Now, if it becomes more complicated and different situations, that's an area that I can help more with. But it doesn't mean that I can't help with the routine screening. And if your primary care doctor or nurse practitioner or whoever, or your boy's pediatrician is talking about these things, that's great. Now, the access to care, and there's healthcare shortages and there's problems, and sometimes if they're not an OBGYN and with the changes in the research that changes your recommendations, maybe they're not the most up to date, and that can be sometimes a concern and something that I worry about. But you can even see that with some OBGYNs who aren't as much up to date, because it is a quickly moving thing. And there's some societies like the American Cancer Society that say that you can start screening at age 25 and do it this way. And then my society, ACOG, we talk about screening at age 21. And it's really because what this research is showing us that starts to change what we should do and why, and how to evaluate that. Now, is one right and one wrong? That's not necessarily the way to look at research. It's how does that risk apply to you? So the more complicated the situation, the more you should go to a specialist.
Well, thank you, Dr. Klein. That is all the time that we have today, but we really appreciate everyone who has virtually joined in with us, and especially you, Dr. Klein, for taking a few minutes out of your busy schedule to work with us and to talk to us about cervical cancer awareness and answer all of our questions.
Thanks for having me.
And if any of our viewers have any additional questions, please continue to either comment below or feel free to send our profile a message. Or if you want to schedule an appointment with Dr. Klein, please call 615-341-4419. Again, that number is 615-341-4419 or visit NashvilleHealthcareCenter.com.
Thanks, everybody.
I'm having technical difficulties. Thank you again, Dr. Klein, and to everyone who tuned in. February is Heart Month, so please mark your calendars for our next Wellness Wednesday event on February 9th at 12:15. We will have Dr. Henry Okoffer, our Chief of Cardiology here at Nashville General Hospital. Have a great day, everyone.